I didn't feel so happy. I know other people are happy about being pregnant, but I was not happy. I was sad. Not eating, not sleeping nicely. You are alone. When you're pregnant, you are alone. Everybody is talking like you did it to yourself. You don't have anybody when you're pregnant. Everybody just turn their backs on you.
We always see pregnancy as a happy event, but working in a maternity hospital and get to work with these patients, women that are in need, it made me realize that it's not always a happy event.
General population, we estimate about 16% of women have some form of mental health problem, depression, anxiety, and in pregnant women, it was estimated that as much as 35% have some form of depression or anxiety.
For them, depression is, but it must be like that, or it is just like that. It's the norm.
These women just sort of carry on, and people are not always aware of how antenatal and postnatal depression can manifest, or there's just not the knowledge that there is help out there and something can be done. And so people struggle on being depressed, which is really unfortunate because this has, huge negative effects on the mom and the baby, and of course also impacts on the rest of the family.
A lot of women come from homes where there's lots of poverty, people are unemployed, there's abuse happening within their homes, there's the drug abuse, there's violence. They come from areas where there's lots of crime within the area, so they are always being intimidated.
Sometimes our patients, they leave their babies here in the hospital because of the problems that they are having at home. They couldn't share, or they didn't know where to go to share their problems.
Most of the women who are seen in the public health care service are women who live in extreme poverty. By US and European standards, these are women who are living well below the breadline, surviving on less than a couple of dollars per week. These are the women who are most likely to develop distress and depression during pregnancy and postnatally. These are the women who are also least able to actually access mental health services for various reasons that can be as simple as the fact that they don't have the transport money to get from one appointment to another. One of the most distressing things for pregnant women is to find out for the first time when they come to the antenatal clinic that they're HIV positive. It's for the first time that they realize that their partners were possibly unfaithful. So here they are, pregnant and having to deal with this devastating news that they have what to many people is seen as a disease that is going to kill them. They also have to deal with the fact that their unborn child is at risk. They have to deal with feelings of guilt around possibly passing this on. There's still tremendous stigma and discrimination against people who are HIV positive. Many women find themselves in the situation where they are blamed for this, where their partners immediately accuse them of being unfaithful.
We had a patient about 2 weeks ago. After receiving the questionnaire to fill in, it came to the fore that her husband was actually physically abusing her and had just beaten her the morning. And it was to such an extent that she had to be hospitalized.
Men are not working. Most of the time they're at home and they are frustrated. Then they end up hitting their women. Sometimes our patients come here and they say, we must check them if their baby is moving because they had a fight with a boyfriend at home.
Many of the pregnancies that we see, particularly in the public health service, are teenagers, adolescents who've now become pregnant. And in addition to all the other problems that pregnant women may face, adolescents face the fact that in most cases these are not wanted pregnancies. Very often there is no partner has vanished, or there's very little partner support. They have to deal with disapproval from their families if their families know, or alternatively hiding pregnancies. Also because adolescents tend to indulge in more risky behavior, they've also got a high risk of being HIV positive. So there's a huge stress on teenagers who are pregnant, far more so than an adult woman who is pregnant.
I felt bad and then I felt guilty because I didn't plan the pregnancy. The worst part, I didn't plan it. And then I was angry to everyone. It is difficult because they don't understand you and they don't listen. The worst part, they don't listen. Didn't have friends at that time, just sitting alone. There is things that you can't talk with your family. There is things because they don't have that, the ear to listen. They don't listen.
The project's key point of innovation is that it provides a one-stop service to women. Where they're getting their pregnancy care, they're also able to access mental health care.
At Mowbray Maternity Hospital, our project screens all women without medical complications. The social work service addresses the needs of other women at the hospital.
In most setups, women have to go from one clinic to the other. So one clinic for obstetric services, one clinic for psychiatric services. And that's why many women just don't access mental health services. Whereas at the Perinatal Mental Health Project, everything occurs under one roof, more or less at the same time. It's just one appointment that they have to go for, which really increases the ease of service use for women, and I think really gets mental health out there to those women who really need it.
We're not only looking now at the physical side of the mom, we are attending to the emotional side of the mom as well.
We usually screen for mental health problems in the antenatal clinic, where we encounter patients on a daily basis that are in need of psychological counselling.
We had a booking day on Tuesday, and there was about 20 new ladies that walked in here for the first time to come and book. And of the 20 ladies, about 15 of them, had issues that they needed to, speak to somebody about.
And often it is masked. Often only when we hand out questionnaires to screen for depression or a risk for depression do these issues come up.
It's like you're going into their lives, So it's not always easy to open up to us, but when they get the chance and the opportunity is given to them to speak to somebody about all those personal issues, it really helps them.
Before I met the counsellors, it was bad. It was really bad. So you have so many options in mind. Maybe you want to take your own life.
They're given screening questionnaires at their first or second visit. And these are questions that ask them about the way they are feeling. And this picks up aspects of depression, symptoms of depression and anxiety.
The nurses give me the form, and then I read the form. I read. And then I say, okay, fine, I'm gonna fill in. I wanted to fill in the form so I can see the person. I know it's strange to talk to the stranger, but it feels safe sometimes.
We take it from there. I see them for an initial session for an assessment, and we talk together, and I think about what she might need, what kind of intervention she might need.
For most women, psychological distress doesn't simply occur in the postnatal period only. In most cases, it's there for us to pick up during pregnancy, and this is where we choose to intervene in the project.
And by focusing on antenatal screening, you can pick up somebody who is distressed but perhaps doesn't have an outright psychiatric disorder and treat them early enough to prevent that. You also, in many ways, can pick up women who have early onset psychiatric disorders, and if not treating them completely, get them well enough so that by the time their babies are born, they're much more able to cope, and you don't have these issues of mothers who are neglecting babies, abandoning babies, possibly abusing babies. At the worst end of a spectrum, at the very least end of a spectrum, mothers who can't bond with their babies. And while that may sound minor, it has such huge implications for child development. It's absolutely vital that women with distress are treated during pregnancy.
The children of mothers affected by perinatal mental health problems are more at risk of themselves experiencing mental health problems, as well as other developmental problems and intellectual problems. These children are more likely to struggle at school, to have conduct problems, problems with attention deficit hyperactivity, as well as possibly severe psychological problems into adolescence. So if we are able to pick up emotional distress in the mother early during pregnancy, we have the potential opportunity to impact on this vicious cycle of events and possibly have wide implications for society in general.
I wanted to talk to the council, because maybe if you talk to somebody you don't know, she or he is not going to judge you.
I don't give advice. I think the first and foremost important thing about the counselling session is that it provides a safe space in which women can express themselves and in which their feelings can be validated, which is often not happening in their other relationships, their family, their friends, or with their partners.
This session helps me because you talk to somebody you don't know. I can say it's a stranger, you just talk to somebody you don't know, and then she makes you feel safe, just makes you feel safe.
And that provides then a foundation for us to connect and to be able to think about options in her life and resources. So what I like to think about is us thinking together and coming up with possible options or solutions, not me telling somebody what I think they should do.
And then it helps. I feel better when I talk to her, and then she was supportive, taking the positive sides, not just the negative sides.
You know, I try and think quite a lot with women about what's it going to be like when the baby comes, what is her situation like, is the baby coming into a family, what kind of support does she have. So looking for resources to help her through her pregnancy, birth, and looking after the baby is an important aspect of the work as well. The ultimate goal is to be able to expand our service into other antenatal clinics.
There is so many people every day getting pregnant and then getting depressed, wants to go to the counsellors, but there is no counsellors. Maybe like me, I stay in Khayelitsha, and no, there is no counsellors there. So I was lucky because I have my clinic in Mobre.
The majority of women, there aren't any services, and I think there's a huge gap in our obstetric care because we screen for all sorts of medical, clinical problems. We look for all kinds of infections, physical problems with the mother and the baby, and the one thing we miss out on is screening for emotional, sort of mental health problems.
Because women are accessing maternal health services regularly in this country, we have a good antenatal care attendance, we have a unique opportunity to provide them with the additional care that they need in terms of their mental health. So the potential to roll out and the potential for expansion is enormous within the existing structures.
We really believe that the service should be available to all women who are pregnant. They should have access to counselling and psychiatry services during their pregnancy. So that's a long-term goal.
Ideally, we would like every single woman in South Africa to be able to access mental health services at the same time as they are accessing services for their pregnancy and services for their child's care.
In my ideal world, we need a perinatal mental health care project at every midwife obstetric unit or antenatal clinic within the South African healthcare system.
Maybe if I didn't meet you, maybe I wouldn't be here. I can say so. I wouldn't be here because I have some. The depression makes me to commit suicide. I think you made me see those positive sides. I can say so. Yes, I can say so. You're the one who makes me to see the positive sides. I'm here now. I'm fine because I know I have you on my side. I'm very proud to be a mom, a working mom. Yes. I was so proud to be a mom. Yes, yes.